Lung sounds. Everybody freaks out and they're like, I can't differentiate it. Relax. Take a deep breath. I'm going to give you some examples of what they sound like. And I think this is really going to help you in nursing school and also as a brand new nurse as you are auscultating your patient's lungs. You could be like, oh, that's what that is. Okay, so here we go. Number one, normal breath sounds. Listen to your own breath sounds in a paper bag or in an enclosed room. It's just free air moving through a space. Imagine air just moving through a nice wide open tube, no resistance, normal breath sounds. Listen to your own breath sounds if you'd like. Next is crackles. These are coarse crackles. You hear that? It sounds like somebody is calling you in their pocket. It's like a low pitch, muffled sound. Now let's listen to fine crackles. It sounds like someone's calling you in their pocket, but it almost has like a water feature to it, and it's a little bit higher pitched. Next, these are diminished breath sounds. It almost sounds like when you're like scuba diving or breathing through a snorkel, diminished breath sounds. You're not getting the full exchange of gas and air. You're not getting the all the way open and all the way closed. Next is wheezing. That's more like expiratory wheezing where they're like, okay, so like if you're inhaling and you're like, that is wheezing. I think we all should know what wheezing sounds like, but that's an example of wheezing. Next is wrong guy. I hope you can hear it. It sounds like almost like a fish like blowing bubbles, like that. It has like a water feature to it. Next is stridor. Sounds like someone wheezing and dying underwater. Stridor, it's very, 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 very bad. I hope that helps you with how to auscultate. Always listen from the front and compare sides and listen from the back as well. So yeah, let me know if this video helps you and let me know what else you want to learn that I can help you with.